Good morning and welcome to my YouTube channel Pain Free Partha. Subscribe and enjoy, listen and enjoy. So Pain Free Partha is my YouTube channel. Now we are going to discuss something new about lead aprons. This is a short video about what is the necessary knowledge, needed knowledge for anesthetists or pain physicians to know about lead aprons. So whenever I talk anything on academics, I put a big salute to the legendary teacher of 2 centuries, Professor Ravi Shankar, and this is our institute, Mahatma Gandhi Medical College, Sri Balaji Vidyapeeth, Pondicherry. Now, what are exposed to this radiation? Something like Siam is having CT is going on, who are all exposed, leave alone nurses, technicians, and patients, all are exposed. We are exposed. Orthopedicians, radiologists, anesthetists, pain physicians, neurologists, cardiologists, oncologists, everyone starts doing interventional procedures. So radiologist even now does PCNL. So it's going on like this. Everyone starts doing interventional procedures. Neurologist starts doing this. So as anesthesiologist, we should know about what is the radiation, how to protect from radiation, what are the radiation safety measures in a small clip of video. Okay. Now, what are the advantages of anesthetist is we stand little distance from this. And if you say 25 seconds per patient, the annual safety limits may be 2,800 to 3,000 cases, a normal case. Angiography, angioplasty, embolization, uterine fibroids. So many things have become like this. Ablation procedures, almost all ortho procedures. Previously, they used to have only closed procedures. Now, if they open the clavicle and do a plating also, they check with CRs. So it's become like this. So many pain procedures. This is C arm and there is something called G arm. You don't need to rotate it. The AP view will come, the lateral view will come like this. You may not need to rotate here and there. CT scan exposes patients to higher radiation dose than CMs. The dose of is 3 mgi per second milligrays and X-ray is 0.4, but time is important. 1 rem is equal to 10 milligray. 1 sievert is equal to 100. What we routinely use is MSV. What sievert is 100 REM. REM is Röntgen equivalent man. It is what the original radiation unit used. REM, millirem. Chest X-ray 2 millirems. Dental, you can see the CT pelvis, see abdomen CT for the patient. There are annual maximum in terms of millisieverts. Those to the eye, those to the thyroid, something like that. I will come back again with simple things to know about. Okay? Because REM is there, milligray is there, MSV is there, so many things are there. So I will put 2 to 5 millirem for a CM if you are unprotected, that is distant. And you need 5,000 millirems or 5 REMs in a year to stay really exposed. The problem here is who is using what kVp. For example, the orthopedicians will see radius in 50 kV. But sometimes if you want to see the spine, 100 maximum, they'll prick and they'll continuously, it'll be screening like this. Instead of tuck, short, well, there will be a continuous things. All these things matter, but normally it is 2 to 5 millirem for a C-arm shot, and we need 5,000 millirems to say it is exposed. There are few major determinants. That's what I said. Time of exposure, how much time? It is cumulative. How much time we are exposed, how close we are we shaken? These 3 things are important. Sometimes we cannot change these 2, but we can definitely change this. There are 3 sources. Now the C-arm is pushing. Direct radiation from the C-arm, tube is leaking, scattered from the patients. So what is important is only scatter from the patients because tube leaks are very rare and direct radiation don't come to us. Why do we need to shield? Deterministic effects is hair loss and cataract. Stochastic effects is cancer genetics and teratogenesis. So these are all the 3 things which we know. But what is important is cumulative. Ovaries, testicles, bone marrow, breast, lens of and thyroid. Lens of eye and thyroid. So These are the organs which are sensitive to radiation. Now, very, very important. Somebody will say, I am standing behind the pillar. Okay, I am standing in the next room operation theater. Okay, all these things. There is a wood patch between that. All these things doesn't matter much. All these things, usually even the human body, it penetrates. It goes through the floor. It goes through the roof. There is definitely things. But more importantly, if there is steel inside, RCC concrete, it is less. Without concrete, it is only a small partition, then it will go through that. So you need high aluminium cement, high magnesium Portland cement for it to block. Otherwise, it will go through the whatever these things you have. They are detected on the other side of the human body also. Either you should wear a proper lead apron, or you should be an outstanding anesthesiologist outside some 5 to 7 meters away from the operation theatre. People always say, can I stand behind person? I will stand against it. I will just do like this side. All these things they will do. So, yes, if the person is wearing a proper lead apron and you are standing behind him without a lead apron, it is adjustable. It is not correct, but it is adjustable. But the problem is he will move. Somebody will ask for urgently normal saline. He will move out and you are directly exposed. So, it is preferable everyone wears lead aprons. Now, normal lead apron is very thick, but it's only 0.25 millimeter sheet of lead and 0.5 millimeter lead of sheet. It is not full lead. We cannot lift it only. It will be 50 kilos. Lead aprons of 0.25 will block 90%, and 0.5 will block 99%. Even 1 millimeter are available, but they are not used normally. So what is commonly used is 0.25 millimeter of lead. This is what is there in your lead apron, 0.25 millimeter of lead sheet thickness. So that is enough to protect from us from the radiation 90%. Wear wrap-around aprons because you go that way, this way, you talk to a computer, you just check it, and you go and take one ciprofloxacin ampule, all these things. So, wrapper, store and wear properly. Assess annually. Consider lead-free options. I'm coming 1 to 1x. Okay, this is what is called the back. This is not back cover. Even pregnant persons can wear like this. This is very important if you go that way, this way and all. Okay. The thyroid shield should be wearable whenever lead aprons. Thyroid gland is sensitive to radiations. There are less advantages with thyroid shields. There are studies which prove that thyroid shield is all that not important. That is why some of these anesthetists refuse to take these thyroid shields. The garment should fit us properly. Okay. I'm having an orthopedician who is around 120 kilos. And I am taking this garment and putting like this. There is no use. The garment should clearly fit like you. Okay. Otherwise, there are a lot of curves as the radiation will go in between. It is better to wear protective gloves. Sometimes what they do, the orthopedicians, they will do like this and they will put a small nail and see whether this is on the right path from the skin. Their metacarpals will be shown in the C-arm machines. So that is preferable. Orthopedicians should wear these things. Lead glasses because lens may be affected, poor lens. So lead glasses are available. So this is what I told about shielding. And the next is about how to use this. You see, whenever you enter the theater, it will be like this. Whenever you go out to the theater, it should be like this. Okay. Should never be like this. Should always be like this. Never be like this. If you do like this, here there will be a curve, there will be this thing, and here the lead will be broken. So there is no use. Waist of the apron is very vulnerable. So waist, they will fold like this and finish the lead sheet, and people are exposed to radiation. So this is thick and this is no. Okay. So now there are a lot of people who wear badges. TLD badges. What is this TLD? Thermoluminescent dosimeter. Thermoluminescent dosimeter. This has got lithium fluoride, mainly lithium, calcium fluoride. What, when they are exposed to radiation, they become slightly heated and emit radiation, from which the how much is the dose of radiation is calculated. Okay, this is what is called TLD badge. Now, TLD badge is a passive radiation detection device. It should be changed. TLD device, everyone should change. There will be a circular and everybody should change. The cassette will be changed. The name will be there. Okay. Now, ideally, we should wear one here lead apron above and inside the lead apron. Inside the lead apron, because we will know how much the lead apron is affected working also. And sometimes some people wear near the neck and sometimes people wear near the abdomen. Okay, so only one dosimeter now, it is outside the lead apron. Okay, here in the neck. Two dosimeters now, one here, one inside. One dosimeter now outside. This is how it should be. On your body, trunk, waist or collar, the name label should face outwards. Okay, understand? With the sliding window facing you. It should not be ulta. The name label should face outwards. Yes, Parthasarathy will be there. It should go and face outwards. There is sliding window for a cassette. That should be other side. Okay. You are wearing, you can wear the badge either you or under your apron. There are different type of badges. We can have chest badges. We can have wrist badges also. Yes, they should be returned and detected every 3 months according to the protocol of the institution. Now, fantastic 0.25 millimeter of lead apron is clearing fantastic. 90% of the radiation is out. We are safe. But the problem is lead apron is very heavy, cumbersome, tiring to wear, especially for extended periods. If the surgery goes on for some 6 hours, we will be having backache, headache, shoulder. Sometimes the radiation is there, you may have headache also. So lead is a toxic substance, posing environmental and health risks. If you just pour the thing into the ground and this goes into the sea, think of all these things. So lead is a toxic substance and it needs environmental, clear, proper disposal. I am very confident that in many theaters, they will garner bacteria. So many times I tell, let this thing be inside the theater so that let these lead aprons be inside the theater. So they are given some formaldehyde or fumigation, non-formaldehyde fumigation. They can also be exposed to this. So some bacteria is killed. So otherwise, they will garner bacteria and they become dirty. These are all the problems of lead aprons. CM should be replaced every 5 years. That's what they say. Because if you don't replace the main tube, X-ray detection tube, this thing tube, there may be leaks, there may be problems. A local scrap metal recycler or a local waste disposal site, hazardous waste processing company. It is always better to exchange the CM. If you exchange, the company will take care of the disposal. That is better. There is something called lead-free aprons. Lead-free apron is containing no lead. It is be looking similar to that, but it has got aluminum, antimony, all these things. Yes, they have proved that this is similar to action and it also protects from radiation. Aluminum, antimony, barium, bismuth, tin, titanium, and stone. Now the difference is a similar lead apron will be weighing 7 kilos, but lead-free apron may be only 4 kilos. That's the best advantage of a lead-free apron. Now we can see Egnest XR system, carbon filter sled-based mattress. Patient and the operator, between the operator and the patient. Now you can see here, there are shields like this. So from the patient, the scatter radiation is less. So this is scatter radiation. There are so many systems like this. Now these are all the people who are exposed most. You see here, this fellow is showing the back. And this person is little distant from the CM. We can have here, there is a big lead apron device. Now you see here, the lead apron devices are here like this. The lead apron devices are here like this. This is not apron. These are lead sheets. They are protecting these people. There may be like this. Here you can see this is the lead sheet. The scatter is decreased to that person. The zero gravity biotronic, you can see here, this is slightly sliding and this is dropping down like this, and a person goes inside this. He is not wearing any weight also. No bearing of weight. It is simply coming down from this sliding grip. You can see this rod. They have proved that radiation safety education is important, and if they are well educated about radiation, the radiation is less. So it is essential to educate about how many millirems, how many rems, how much you are exposed, how much your thyroid, breast are exposed. All these things should be told. And we should know, can ultrasound partially replace these things? For example, CT guided biopsy can we do under ultrasound? If CT guided or fluoroscopic guided some blocks, can we replace with ultrasound? So what is a summary I want to give? Exposure maybe up to 2 milligram each shot of CM. And we need 5 REMs in a year for cumulative. What matters is the cumulative time and the distance from the shield, whether we use or not. If you are 1.5 meters away from the so-called tube X-ray, it is less exposed. Lead aprons 0.25 millimeter can freeze. You need to wear properly and you need to maintain properly. That TLD batch will help you in assessing the radiation which we are exposed to. Yes, problems are there with lead aprons. They are heavy and it is very difficult to maintain. Sometimes you will have waste is exposed because your lead is not correct there. It is very difficult to dispose the lead also, problems in disposing lead. So that is why we have lead-free aprons. To decrease the weight, there are aprons coming down from there. Thank you all. Thank you very much. Visit me at Pain Free Partha on YouTube and sites at www.painfree